Are you waking up tired, feeling weaker, noticing changes in performance that no one ever warned you about? Many men over 60 quietly start to wonder if something as normal as masturbation could now be hurting their health. I'm Dr. Rachel Ross, a board-certified urologist, and for over 15 years, I've helped men protect their hormones, circulation, and confidence. What most men don't realize is that 3 common mistakes can silently worsen prostate symptoms, testosterone decline, and fatigue, even though they seem harmless. Tell me where you're watching from, and if men's health matters to you, consider subscribing. But here's what most people don't realize. Nothing suddenly breaks when you pass 60. Your body doesn't fail overnight. What actually happens is far more gradual and far more normal than most men are ever told. I see this every week in my clinic. Men come in worried, confused, sometimes embarrassed, convinced something is wrong with them. Because erections feel different, sensitivity has changed, or recovery takes longer than it used to. And the first thing I tell them is this: nothing is broken. Your body is simply different now. After 50, and especially after 60, male physiology begins to shift in predictable ways. Testosterone doesn't disappear, but it does slowly decline year after year. That hormone influences everything from desire and energy to blood flow and nerve sensitivity. When levels are lower, arousal often builds more slowly. Sensations may feel muted compared to decades earlier, and that can be unsettling if no one has ever explained why it's happening. At the same time, circulation changes. The blood vessels that supply the penis are small and delicate. With age, they naturally lose some elasticity. This doesn't mean blood stops flowing, it just means it arrives more gradually and requires stronger signaling. Erections. Why things change after 60. May take longer to develop. They may not feel as rigid right away, and they may fluctuate more than they once did. That's not dysfunction. That's physics and biology working together in an aging system. Nerve signaling also slows slightly over time, the same way reaction time changes in your hands or balance shifts subtly in your feet. The sensory nerves involved in arousal don't fire quite as quickly as they did at 30 or 40. That delay can change how stimulation feels. Some men interpret this as loss of masculinity. In reality, it's simply nerve conduction speed, a natural part of aging that happens in every organ system. Then there's the refractory period in the recovery time between arousal and readiness. Again, in younger years, that window might have been minutes or hours. After 60, it's often longer, sometimes a full day, sometimes more. And again, men assume something is wrong. But this is one of the most consistent age-related changes in male sexual physiology. It's not a warning sign, it's an adaptation signal. The problem begins when men try to fight these changes instead of working with them. I often hear, "Doctor, I'm doing exactly what I've always done, but it doesn't work the same anymore." And that sentence tells me everything, because doing things the same way after 60 is often the reason frustration begins. Your body now responds better to patience than urgency, to circulation rather than force, to rhythm rather than intensity. The expectations that worked at 35 were built for a completely different hormonal environment. When those expectations don't adjust, anxiety fills the gap. And anxiety, more than aging itself, is one of the biggest disruptors of performance and confidence. This is why removing shame is so important. You are not behind, you are not abnormal, you are not losing your masculinity. You are simply living in a body that has earned its years. A body that still responds, still adapts, and still functions remarkably well when treated correctly. I tell my patients this all the time. Aging is not dysfunction. Aging is transition, and every transition requires new strategies. When technique, frequency, and expectations align with physiology, most men experience better comfort, stronger responses, and far less frustration, even if things look different than they once did. Understanding this alone brings enormous relief, because once you stop blaming yourself, you can start working with your biology instead of against it. And that's where real improvement begins. But the first major mistake I see men making after 60 is one that quietly damages circulation, and almost no one talks about it. Now, here's the mistake most men over 60 make without even realizing it. They use far too much pressure, not because they're doing anything wrong on purpose, but because their body no longer responds the same way it once did. Sensation feels muted, arousal builds more slowly, and instinctively you compensate. You grip tighter, you move faster. You apply more force, hoping to recreate a feeling your nervous system no longer delivers instantly. I hear the same phrases again and again in my office. It takes longer than it used to. Sensitivity doesn't feel the same. I have to work harder just to get a response. And those statements are honest, But the compensation that follows is where problems quietly begin. As men age, penile tissue loses some of its elasticity. The smooth muscle fibers that once expanded quickly with blood now require more time and gentler stimulation to open fully. At the same time, the smallest blood vessels, what we call the microvasculature, become more fragile. They still function, but they're less tolerant of mechanical stress. When excessive pressure is applied repeatedly, it doesn't strengthen erections. It actually disrupts the very circulation you're trying to improve. Aggressive technique can compress blood vessels rather than encourage flow. It can irritate sensitive nerve endings instead of awakening them. And over time, this repeated stress can trigger low-grade inflammation within the tissue itself. Inflammation interferes with nitric oxide, the chemical messenger responsible for relaxing blood vessels and allowing erections to form and stay firm. This is where desensitization begins. Not sudden numbness, but gradual dulling. The nerves become overstimulated, then less responsive. The brain receives inconsistent feedback. Erections may start strong but fade unpredictably. Some days things work, other days they don't. And that inconsistency creates anxiety, which further tightens blood vessels and deepens the cycle. What's important to mistake number one understand is that this isn't damage in the dramatic sense. It's functional stress. Your body is reacting exactly as biology dictates. When tissue is overstressed, it protects itself by reducing sensitivity and limiting blood flow. That's not failure, that's defense. In younger men, the tissue rebounds quickly. After 60, recovery takes longer. What once caused no issue can now quietly undermine confidence over months or years. And because no one talks about it, men assume the problem is age itself rather than technique. From a medical standpoint, blood vessels and nerves respond best to gentle, consistent stimulation. Slow signaling encourages nitric oxide release. Steady rhythm allows smooth muscle to relax fully. The goal is not friction, it's circulation, not intensity, but communication between brain, nerves, and blood vessels. I often tell my patients something that surprises them. Less pressure almost always produces stronger erections over time. When stimulation is gentler, the nervous system stays engaged rather than overwhelmed. Blood flow improves instead of being compressed. Sensitivity gradually returns because nerves are no longer in constant defense mode. This doesn't mean arousal disappears. It means it builds differently, more slowly, more steadily, and often more comfortably. Many men report that once they stop forcing sensation, erections become more reliable, not because they're chasing intensity, but because they're supporting physiology. This shift requires patience, especially if you've spent decades doing things one way. But adapting technique is one of the most powerful ways men over 60 protect circulation, preserve sensitivity, and reduce performance anxiety. And yet, even men who successfully make this adjustment often continue to struggle because there's a second mistake hiding in plain sight. One that directly affects testosterone, sleep quality, and next-day energy. But here's the next mistake. Almost no one connects to sexual health after 60. Poor timing. Not what you do, but when you do it. And this one quietly affects hormones, sleep, and energy far more than most men realize. I often hear men say, "Doctor, I sleep 8 hours, but I still wake up exhausted." Or, "I fall asleep fine, but I'm wide awake at 2 in the morning." And many are surprised when I explain that nighttime habits, especially stimulation late in the evening, can interfere with the very hormones your body depends on for recovery. Let me explain this simply. Testosterone is not primarily produced during the day. It's produced at night during deep, uninterrupted sleep. Those early sleep cycles, especially the first 3 to 4 hours, are when the body repairs tissue, balances hormones, and restores energy. If those cycles are disrupted, testosterone output drops, even if total sleep time looks adequate on paper. Late-night stimulation alters that process. It increases dopamine, the brain's alertness chemical. Dopamine isn't bad, it's motivation and pleasure, but it signals the brain to stay awake. At the same time, the body releases prolactin afterward, a hormone that promotes relaxation, but also temporarily suppresses testosterone signaling. In younger men, this hormonal swing resolves quickly. The nervous system resets overnight. After 60, however, the reset takes longer. Hormones fluctuate more dramatically, and the brain becomes more sensitive to disruption. The result is fragmented sleep. You fall asleep, then you wake up. Your mind feels alert, but your body feels heavy. You drift back off only to wake again. By morning, you've technically slept 8 hours, but very little of it was deep restorative sleep. That's why fatigue builds quietly, not because you aren't sleeping, but because your sleep architecture has been altered. When deep sleep is shortened, testosterone production declines. When testosterone declines, libido weakens, muscle recovery slows, and energy dips the next day. The cycle reinforces itself. Many men assume the solution is more caffeine, more supplements, or simply mistake number 2, accepting aging. But timing alone can make a measurable difference. Earlier stimulation well before bedtime allows dopamine to normalize before sleep begins. Melatonin, your sleep hormone, rises naturally. Deep sleep cycles stabilize. Testosterone production improves not because of medication or treatment, but because your body is finally being allowed to do what it's designed to do. I've seen men regain energy simply by adjusting timing. No drugs, no devices, just respecting how the aging nervous system works. Sleep quality protects libido more than most men realize. It protects mood, focus, motivation, even confidence. When sleep improves, arousal becomes easier, erections become more reliable, and daytime fatigue lifts. This isn't about restriction, it's about alignment, supporting your body's natural rhythm, instead of unintentionally fighting it. And yet, there's one final mistake many men still make. One that doesn't just affect hormones or energy, but the prostate itself. Now here's the final mistake I see far too often. Ignoring the quiet signals your prostate is trying to send you. Not dramatic pain, not alarming symptoms, just subtle changes that many men dismiss as normal aging, even when their body is asking for attention. After 50, the prostate naturally enlarges. This happens to nearly every man. It's driven by hormonal shifts that occur with age, not by anything you did wrong. But as the gland grows, it becomes more sensitive to inflammation, dehydration, pressure, and pelvic tension. When those factors combine, symptoms can slowly appear. Weaker urine flow, more nighttime trips to the bathroom, a sense of pressure or discomfort after ejaculation. What many men don't realize is that habits surrounding stimulation can influence how the prostate feels day to day. Not in an extreme way, but subtly over time. There's a persistent myth that masturbation either harms the prostate or must be avoided entirely. That's simply not supported by medical evidence. At the same time, the opposite belief that more is always better can also create problems. The truth lives in the middle. The prostate doesn't need extremes. It needs consistency. When frequency becomes excessive, inflammation can increase. When long periods of tension are followed by sudden release, pelvic muscles may spasm instead of relax. Over time, this can contribute to lingering discomfort or a sense of heaviness in the pelvic region. Pelvic floor tension plays a bigger role than most men realize. These muscles support bladder control, ejaculation, and prostate drainage. Chronic clenching, and often caused by stress, rushing, or anxiety, keeps blood from flowing freely through the area. That tension can irritate surrounding nerves and worsen urinary symptoms. Healthy release supports circulation. Strain does not. Hydration is another overlooked factor. The prostate relies on adequate fluid balance to reduce inflammatory concentration in prostatic fluid. When men are mildly dehydrated, which is extremely common after 60, secretions become thicker. This can contribute to irritation, pressure, or discomfort. I often tell my patients, your goal is circulation, not force. Gentle stimulation combined with hydration allows blood flow and natural drainage without stressing tissue. Equally important is awareness. Pain, burning, or urinary changes are not things to push through. They're information the prostate communicates through sensation and flow. Ignoring those signals doesn't make them disappear. It simply delays correction. This is not about fear, and it's certainly not about abstinence. Most men benefit from regular moderate sexual activity that supports circulation and reduces stagnation. But moderation matters, rhythm matters, listening matters. When habits align with physiology, many men notice improved comfort, fewer nighttime bathroom trips, and a greater sense of ease afterward. Small adjustments often make a meaningful difference. And that brings me to the most important message of all. Because here's the part most men truly need to hear. It's not too late. Mistake number 3. But here's what I want you to understand. Aging is not loss, it's adaptation. And those two ideas could not be more different. Loss suggests something is gone forever. Adaptation means the system is changing, adjusting, asking for a new approach. And the male body is remarkably good at that, even well into your 60s and 70s. I've seen men in their late 60s restore energy simply by correcting habits they didn't even realize were working against them. Not through extreme programs, not through shame or fear, just through understanding how their body functions. Now and responding accordingly. Your body is listening. It's always listening. Every signal you send through sleep, hydration, stress, movement, and routine shapes how your hormones respond. When those signals are chaotic, the body protects itself. When they're calm and consistent, the body begins to recover. Many men arrive in my office convinced they're broken, that something irreversible has happened. But most of the time, what they're experiencing is confusion, not damage. Their physiology has shifted, but no one taught them the new language their body speaks. You are not weak for needing adjustment. You are not failing because things feel different. Strength is not pretending nothing has changed. Strength is adapting with intelligence and self-respect. Masculinity does not disappear with age. It evolves. It becomes quieter, steadier, more intentional. And when men learn to work with their biology instead of fighting it, confidence often returns. Not as bravado, but as calm certainty. Recovery doesn't require perfection. It requires consistency. Small changes applied steadily create powerful results over time. Better sleep restores hormones. Gentler habits protect circulation. Awareness reduces anxiety. And anxiety, once lowered, allows the nervous system to function normally again. I've watched men regain morning energy, improve urinary comfort, feel desire return gradually, not forced, not rushed, but naturally. And perhaps most importantly, they stop feeling alone with their questions because silence is what harms men most. Not age, not hormones, silence. And that's why I created this channel. So men don't have to navigate these changes in silence. You deserve clarity. You deserve dignity. You deserve guidance that respects both science and the lived experience of aging. And as long as your body is breathing, adapting, and responding, improvement is always possible. The next step is simple. Stay connected. Stay informed, and take care of the body that's carried you this far. But here's what I want you to understand. Aging is not loss, it's adaptation. And those two ideas could not be more different. Loss suggests something is gone forever. Adaptation means the system is changing, adjusting, asking for a new approach, and the male body is remarkably good at that. Even well into your 60s and 70s, I've seen men in their late 60s restore energy simply by correcting habits they didn't even realize were working against them. Not through extreme programs, not final advice through shame or fear, just through understanding how their body functions now and responding accordingly. Your body is listening. It's always listening. Every signal you send through sleep, hydration, stress, movement, and routine shapes how your hormones respond. When those signals are chaotic, the body protects itself. When they're calm and consistent, the body begins to recover. Many men arrive in my office convinced they're broken, that something irreversible has happened. But most of the time, what they're experiencing is confusion, not damage. Their physiology has shifted, but no one taught them the new language their body speaks. You are not weak for needing adjustment. You are not failing because things feel different. Strength is not pretending nothing has changed. Strength is adapting with intelligence and self-respect. Masculinity does not disappear with age. It evolves. It becomes quieter, steadier, more intentional. And when men learn to work with their biology instead of fighting it, confidence often returns not as bravado, but as calm certainty. Recovery doesn't require perfection. It requires consistency. Small changes applied steadily create powerful results over time. Better sleep restores hormones. Gentler habits protect circulation. Awareness reduces anxiety. And anxiety, once lowered, allows the nervous system to function normally again. I've watched men regain morning energy, improve urinary comfort, feel desire return gradually, not forced, not rushed, but naturally. And perhaps most importantly, they stop feeling alone with their questions. Because silence is what harms men most. Not age, not hormones, silence. And that's why I created this channel, so men don't have to navigate these changes in silence. You deserve clarity. You deserve dignity. You deserve guidance that respects both science and the lived experience of aging. And as long as your body is breathing, adapting, and responding, improvement is always possible. The next step is simple. Stay connected, stay informed, and take care of the body that's carried you this far. But before you go, let me say this. If you found this guidance valuable, I invite you to join our community and subscribe so you never miss future videos created specifically for men over 50. This channel exists for men who want clarity instead of confusion, confidence instead of doubt, strength instead of silent worry, and deep restorative sleep that allows the body to truly recover. You deserve energy when you wake up in the morning, not exhaustion that lingers all day. You deserve confidence in your body, not uncertainty, every time something feels different. And you deserve honest medical guidance delivered with respect, without embarrassment, shame, or fear. The 3 mistakes we discussed today are not permanent damage. They are patterns, and patterns can be changed. With simple adjustments, you can protect circulation, support testosterone production, reduce prostate irritation, and restore balance in ways many men never realize are possible. Nothing we talked about requires extremes, no drastic measures, just understanding how your body works now and giving it the right signals at the right time. You are not behind, you are not broken, you are not too old to improve your health. You've carried this body through decades of work, stress, responsibility, and sacrifice. It deserves care, patience, and respect in return. So stay connected, keep learning, and take care of your health because you are worth